challenges in the outpatient ortho setting that seems to be turning patients away. So challenges for the outpatient ortho setting is that patients have figured out the physical therapy either doesn't work or only has short-term gains. That's why they're fleeing physical therapy. That's why the majority of patients don't return. Not the majority, but I think it's 14% of patients don't return after their eval. And I think it's over half of patients don't finish their plan of care. They figured out physical therapy doesn't work because you guys aren't learning what you should be learning in PT school. You're learning how to take a test instead of how to be a clinician. So that's great for me. So that's not a challenge for me because I don't do the conventional PT, which means my patients come in, I can say, this is why your previous PT didn't work. This is why we're not going to do that. And here's what we're going to do instead. And they get better in 1 to 2 visits. So that's fantastic for me, but that's going to be a long-term challenge for conventional PT. That is why clinician-owned PT clinics, in my opinion, will disappear soon and be run over by physician-owned and hospital-owned big medical conglomerations that are going to continue to push the broken medical model and just make people pay for things that aren't going to work. Okay, as a clinic owner, what's the best way to build relationships to grow my patient population? Give people results. That's all they care about. They don't care about my doctor of physical therapy. They don't care about my strength and conditioning certification. They don't care about my OCS certification. They don't care about anything except, can I get them back on the field, back on the pickleball court, back playing with their grandkids, whatever. All they care about is results, period. So in order to do that, what do they care about? They care about this. That is a United States patent that says that what I do is protected and I'm the only one that can do it other than the people that I teach. And that's what differentiates me from everybody else. So if you don't want to fall in the broken medical model, if you want to own a clinic, especially if you're going to go try to own a cash pay clinic, don't waste patients' time with hour-long visits. Don't waste their time and money giving them treatment that they get somewhere else. Differentiate your skill set and offer something that nobody else offers and give them results because that's all they care about. So what sets apart great PTs from average PTs? 2 things. 1, the ability to think critically, which they don't teach you in school. So if you're going to become a critical thinker, you're going to have to learn how to do that after you get out of school. School doesn't teach you how to think. School tells you what to think, okay? So you need to figure out how to ask the pertinent questions to get the information that you need so you learn how to think. Because once you get out in the clinic, every patient is coming in for the same root cause of their problem, but every patient is unique and you have to have the ability to think through that, which school is not going to teach you. So number 1, the ability to think critically. Number 2, the ability to apply science. So what else don't they teach you in school? How to apply anatomy and physiology and neuromuscular physiology and biomechanics in a clinical setting. You're not getting out of school to take tests for the rest of your life. Taking tests are over the day you pass your boards. Then it's time to be a clinician. And if you don't know how to apply anatomy, physiology, biomechanics in the clinic, you will struggle, you will fail, you will reach for shiny objects and symptom modification gimmicks and you'll fail. So great PTs think critically, take apart their thinking and treat everybody uniquely and apply the science that you learned in school but didn't learn. Trends that are shaping the future of orthopedic physical therapy. So the biggest trend is it's going to be dead. Pretty soon, according to me, my thoughts are going to be within 10 years, outpatient orthopedic physical therapy will be dead. What will be left of it will be owned by physician groups and hospitals. Unfortunately, the physical therapists of the 80s and 90s and early 2000s gave away physical therapy to everybody else. So there's nothing that physical therapists own. So anybody can do anything that a physical therapist does with the exception of bill insurance for physical therapy and call themselves a doctor of physical therapy. And patients have figured out that doctors of physical therapy aren't any better than the masters of physical therapy in the 80s. And that's why they don't show up for their follow-up visits. So the trend for outpatient PT is it's going to be dying because we keep giving it away with things like cupping and needling and massage and all that junk. And I don't see any way that we're going to circle back and actually start basing what we do on science, which is what we should have been doing from the beginning. As far as strength and conditioning, that's going to be going through the roof because people have figured out you don't need to go to 7 years of school and accumulate 6 figures of debt to treat patients as long as you don't call yourself a physical therapist and you don't bill insurance. So that's why everybody's going cash and they do everything that physical therapists do without the years of education and the debt. One piece of advice for new grads is to understand that when you walk across that stage and you get your diploma, your work is not over. You are average at best. PT school did not teach you how to be a clinician. Your rotations did not teach you how to be a clinician. They taught you how to fall into the broken medical model, push the agenda, take tests, and that's it. So if you want to be an elite clinician, you are going to have to go learn how to apply the important things that you learned in PT school, which is anatomy, physiology, biomechanics. Learn how to apply those things. Learn how to apply critical thinking in order to get to the root cause of your patient's problems. Once you do that, you will be an elite clinician and you will have a skill set that very, very few clinicians, PTs, OTs, doctors, chiropractors, athletic trainers have because their professions are in the same predicament. They are out there chasing symptoms. So as soon as you take yourself out of that mess by learning more and finding a mentor who can get you out of the mess because they got themselves out of the mess, that's what's going to make you happy. So most DPTs quit the profession within 2 to 3 years after graduation because they didn't push themselves after graduation. So your work is not over when you graduate. Your work isn't over when you got your boards done. It's time to do real work.